All right, it's 7:05, and so in the spirit of being respectful of everybody's time, and we do have some great panelists who I think, just have some really great information to share, we're going to get started. So good evening, everybody. Thank you for joining us. My name is Jeanette Gisbert. I am the Executive Director of Volunteer New York. And your moderator for this evening's conversation. For 70 years, Volunteer New York has worked in partnership with hundreds of local nonprofits to inspire individuals to get off the sidelines and volunteer in their community. Last year, we inspired more than 35,000 individuals, families, and groups to volunteer throughout Westchester, Rockland, and Putnam counties. This is a 30% increase over the past year, in part due to people stepping forward during the pandemic to support critical community needs, including the issue that brings us here today, the issue of hunger and food insecurity. Combined, these volunteers contributed over 362,000 hours of service to more than 300 nonprofits, at a value of over $11.7 million to our community. For the past 10 years, Volunteer New York has planned and implemented a community-wide action day on 9/11, providing our local community the opportunity to join thousands of individuals across the country as they honor the memory of those lost on September 11th, 2001. As has been the case with so many things over the last 6 months, Volunteer New York had to reimagine how we offer this opportunity this year. So the Volunteer New York team did what it does best, serving our community needs so that we can connect people power to where it is most needed. Ultimately, we decided that we would focus the power of community and volunteering on a single goal: fighting food insecurity. It is where together we felt we could make a meaningful difference. As many of you may be hearing on the local and national news, food insecurity has been on the rise in this COVID-19 filled world. In Westchester, we have seen a 40% increase in food insecurity in the county, with some pantries seeing triple-digit increases in people accessing their services. The goal of today's panel, presented as part of the annual 9/11 Serve and Remember event, is to learn from nonprofit leaders and food insecurity experts about the state of hunger in Westchester and Rockland counties, and the best ways that we, as a community, can respond. We will hear from these authorities on how food insecurity and hunger is impacting the most vulnerable in our community, how local organizations are fighting back, and how volunteers can take part in this fight. We are so incredibly grateful that each one of these panelists has carved out time from what are incredibly busy calendars to speak with us today. We are also very thankful to WMC Health, whose support made this conversation possible. It is my pleasure to welcome our panelists. Tonight, you will hear from the new CEO of Feeding Westchester, Erren, the Senior Vice President of Diversity, Inclusion, and Community Engagement for Westchester Medical Center Health Network, Mecca, the Deputy Director of Operations for the Westchester County Executive's Office, Emily Saltzman, an attorney for legal services of Hudson Valley, Thomas Mancone, the Executive Director of Groundwork's Hudson Valley, Brigitte Griswold, and the Executive Director of People to People, Diane Serratore. In order to allow for as much time for conversation as possible, complete bios were shared in your reminder email that you received shortly before this conversation, and will also be available after today's conversation. Shortly, I will stop talking And each panelist will have 5 minutes to introduce themselves, their organizations, and how food insecurity has impacted their organizations and how they deliver their mission. After each person speaks, I'll have a few follow-up questions, perhaps facilitate some conversation among the panel, and then we will open it up to some question and answer. It is my hope that each participant in this conversation today will listen, ask questions, try to understand how food insecurity might be impacting your neighbor. And then, as part of Volunteer New York's mission, we want to arm you with some tangible next steps that you can take to make a difference and a contribution. So with that being said, I would like to ask Karen to begin the conversation. She'll give us a little bit of an overview of who she is, of Feeding Westchester, and what they're seeing from their perspective about how the issue of food insecurity is affecting our community. Karen?
Thank you so much, Jeanette. And I'd also like to thank your team at Volunteer New York for including me with this esteemed group this evening. It's my pleasure to be here with each of you. So yes, I am the new president and CEO at Feeding Westchester. So delighted to be a part of this team, and we'll be talking about some of the direct impact that they and our partners have had throughout the county in the last 6 months. Well, as you can imagine, and I'd like to start by taking a step back and make sure that everyone knows the unique role that Feeding Westchester plays in hunger relief in Westchester County. We actually provide food to our partners, food pantries, soup kitchens, shelters, and other feeding programs. And then in addition, we have direct services, direct distribution, mobile pantries, fresh produce markets that serve in areas that are less served by other partners. So we have the opportunity to ensure that these pantries and other partners, our direct programs, are meeting the need in the communities that they serve. One of the things about COVID-19 is that pre-March, when you thought about Westchester County, it's possible that you thought about wealth and proximity to New York City and a number of factors. Not everyone thought about the hunger that has always been in our community and our county. So as COVID-19 unfolded, and certainly right now as we continue to be at 12.5% unemployment, it has been an opportunity, I believe, for many in the community to sort of say, oh, okay, there is hunger here, there has been hunger here, and it continues. And I'm sure one of the things we'll talk about this evening is we're not coming out of this anytime fast, right? This increased need will be, in my mind, when I think about it, 12, 18, 24 months, we're going to continue to see this increased need. So our pantries throughout the county, and probably many of you all, dealt with a broad range of quickly changing circumstances since March. For a while, we were worried about the supply chain. We had partners who were uncomfortable with health risk and or comprised solely of older volunteers and had to temporarily suspend services. We had partners that were serving the community in need and added hunger programs. So just lots and lots of variables over the last 6 months. What we found is after a peak of serving 3 times as many people as they were serving pre-COVID-19, we have, knock on wood, somewhat stabilized at about twice pre-COVID numbers. So pre-COVID-19, our network of partners and programs were feeding about 150,000 people each month. And right now we're feeding over 300,000 people each month. So that is where we are. As I mentioned, we expect that to continue, that increased need to continue. And our team stepped up in sort of extraordinary ways. Certainly before I got here, been here a month on Thursday. And we are distributing 2 to 2.5 times what we were distributing pre-COVID-19. So July numbers that I just saw, July of 2019, Feeding Westchester distributed 900,000 pounds of food to our partners and programs throughout Westchester County. July of 2020, 2.3 million pounds. And that's an overview of our situation. Jeanette, thank you.
Great. Thank you so much, Karen. That's great. Thank you for that overview and kind of really setting the stage for subsequent points of view and conversations. Mecca, I'm going to ask you to come next to speak about kind of how the food insecurity and accessibility issues kind of trickle down to the various health concerns and really start to kind of elaborate on what that impact might mean for our community.
Sure. So thank you for inviting me to participate at WMC Health. We've always been strong supporters of Volunteer New York, and I'm delighted to be part of this important conversation. Make sure my mic is on. Everyone can hear, correct?
Yeah.
Yes. Okay. So even if it's only virtually, I'm happy to be here and talking about food as a social determinant of health. And to share with the viewers some of the initiatives that we've undertaken at WMC Health to really help remediate the negative impact associated with food insecurity. So for anyone who's unfamiliar with the social determinants of health, these are the various factors such as whether or not you have adequate housing, whether or not you have adequate education, whether or not you're gainfully employed, whether your physical environment is safe, and whether you have access to healthy food. Or another way I tend to explain this is by giving a very stark and realistic hypothetical. So at WMC Health, we have phenomenal clinicians, phenomenal doctors. And so for our doctors who treat patients with cancer, the best oncologist on the planet is of little or no use to a female patient when it comes to breast cancer if that woman is going back into a domestic violence situation. The real and immediate threat to her health and safety isn't the cancer, it's her home situation. You know, imagine the best respiratory therapist is of little or no use to a child with chronic asthma if that child is going back and residing in an apartment that has mold and a landlord who won't do mold remediation. The threat to the child isn't the asthma, it's the housing situation. So these are what social determinants of health are. They're conditions that people are born into, that they grow up in, that they're currently living or working within. And here's why the social determinants of health are so important. Researchers have noted that while roughly 90 to 95% of health expenditures in the United States go towards clinical interventions and medical care and medicine, most experts agree that clinical interventions have really a limited impact on the long-term health of individuals. An individual's health is really determined by a combination of factors. Approximately 20 to 25% is genetics. About only 10 to 15% has to do with healthcare. About 45 to 50% are behaviors, and the other 20% is environment. So again, only a small percentage is the clinical intervention. The rest are all the social determinant related factors. So as hospitals and healthcare providers in general, we've really moved away from looking at purely the clinical work contained within the four walls of the hospital. And we all started focusing more on the social determinants of health and how they impact either helping or negatively in creating substantive and sustainable health outcomes for the communities that we serve. Food is paramount when it comes to health outcomes. Healthy food, healthy behaviors reduce the likelihood of chronic illness, like diabetes, like hypertension, like obesity, like heart disease. Additionally, studies have shown that food insecurity has a direct impact on mental and behavioral facets of someone's life, especially when it comes to children, because they can't focus in school, they can't meet certain developmental milestones due to that food insecurity. So we know that barriers exist for access to healthy food, barriers like inadequate food options. We know that many underserved communities suffer from food deserts. These are areas where there aren't grocery stores or abundant food options. And the options that are there oftentimes don't have the healthiest food. We know that transportation for many underserved communities is an issue. So even getting to a healthy grocery store is a problem. Conversely, the term I've been hearing lately, instead of food deserts, are food swamps. These are underserved areas that are saturated with fast food places or poor quality food options. And, you know, they did a study about obesity in children. And the study noted that the rate for children who live within 1 block of fast food establishments, the obesity rate was astronomical compared to their counterparts who don't live near fast food establishments. Another prominent barrier, of course, to healthy food options and food insecurity is financial. Food and healthy food options isn't necessarily cheap. Another barrier that people don't give a lot of consideration to are the cultural barriers that exist for some communities when it comes to food. For some communities, food is so much more than mere sustenance. You know, food is history. Food is comfort. Food is familial connection. Food is legacy and racial and ethnic pride. And when it comes to food insecurity, there are those racial and ethnic disparities that exist that are also connected to health outcomes. And they're all factors that we should all be looking at when we come to addressing the issue of food insecurity. For us at WMC, we've taken on several initiatives. Many, unfortunately, are on hold due to COVID, to address food as a social determinant. We have a Food for Life Council that we started several years ago, which pulls together local restaurateurs and food purveyors and other food-related external stakeholders with the hope of really exploring and taking on some food-related community initiatives. We launched a Faith and Flavor initiative, which targets our faith-based community partners to focus on healthy food and nutrition. Research has shown that one of the most trusted community partners in any community are the faith institutions. And so in partnering with them, they can preach health and wellness from the proverbial pulpit. We do pop-up kitchens in these organizations. We give them healthy food recipe cards. The chef is often accompanied by a nutritionist who teaches people how to interpret food labels, etc. And it's important to know that with any of these external engagements, our staff is really very much involved in cultural competence and cultural intelligence to make sure they're really being responsive to the needs of the community. I tell people when it comes to food, we don't come in with a finger wag and telling people, you know, you're wrong, you're bad for eating this food. It really is a relationship to empower people, community members, to make healthier choices. And you don't do that by disparaging anyone. You do it by bringing education and bringing resources. Additionally, we partner with organizations like Feeding Westchester. You know, I think it was last summer or the summer before, we did several community events in Ossining with our mobile unit where we went to underserved communities and we did food distribution and disseminated nutrition information. Now, those are a lot of our externally facing initiatives as they relate to food insecurity, but we also have several that are internally facing. We give discharge bags with food to patients, especially patients who have been with us for a long time, because oftentimes they're going home to an empty refrigerator or empty pantry. And so we provide that to families, to patients. We give them that food at discharge. We also do food insecurity screening as part of our normal routine clinical intake. I actually was a patient recently for a procedure, and I was asked the questions, you know, about whether I've been insecure. I've had to worry about where I'm getting my next meal from. And if we get someone who scores high on that screening, then we make sure to connect them with available resources that are out there. And so again, I think these are just some of the efforts that we've undertaken, because at the end of the day, the return on the investment in addressing food as a social determinant of health is huge. Research indicates that healthy food programs really do help reduce hospitalizations. They really do help reduce readmissions, and healthier outcomes in general for patients, for our workforce, for members of the communities we serve is what we should all be striving for. And unfortunately, as I get ready to wind down, you know, COVID has really impacted a lot of that external activity, because we're not able to be out there in the communities, bringing services and meeting people where they are. And so a lot of that is on hold, but we are still undertaking efforts where internally we're planning on doing some food outreach when we take our mobile unit out to do some COVID testing and continuing to share resources with people. We're still partnering with local restaurants. During the height of the COVID crisis, we instituted something called a meal train at WMC, where we allowed for community members and volunteers to support our hospital staff, who were phenomenal, by buying food from local restaurants. I actually got the numbers today. We generated almost $800,000 for local restaurants through that one initiative. So we're happy to be a part of helping secure our other partners, our other businesses in the region, so they can continue to provide the necessary healthy food options for so many community members out there. And lastly, I'll just wrap up by saying that we understand at WMC Health that keeping communities healthy has less to do with what happens inside of the hospital than what happens outside of the hospital. And we really do rely on those partnerships. We really do rely on those critical volunteers who give of their time selflessly to really make sure that we're able to meet the needs of the communities we serve. So with that, I will turn it over to the next speaker, and I welcome some questions as part of this discussion tonight. Thank you.
Thank you so much, Mecca. That was so informative. I had not heard of the term food swamp before, so that's a new one for me. And I would also add that this conversation that we're having today is a strategy to do the kind of outreach in a new COVID-19 world that the hospital has been focusing on to, again, spread the word and educate folks about the different issues related to food insecurity and the social determinants of health. So thank you. Next, I'm going to turn it over to Emily, who's going to give us kind of a countywide perspective. And I think she might also have some things to say about the restaurant industry as well. But Emily, I'm going to turn it over to you.
Thank you, Jeanette. Thank you for having me. So as many of you remember, March 3rd was the day that my phone rang, and it was my boss, Joan, who had just gotten a call from George, who had gotten a call from the governor. This was the first case of community, and Mecca's nodding, like knowing what those calls from the governor are like. Yes. So that was the first case of community spread, and we had to jump into action right away. As our partnership with New York State Department of Health grew, we saw very quickly that there were likely many cases in New Rochelle. Shortly after that case came the shutdowns. And so the first phase of our experience in dealing with food insecurity in Westchester County was just meeting the immediate need. We created a hotline that ran out of our Emergency Operations Center, staffed it with representatives from all of the county departments, and started to get a lot of calls. People who were afraid to go out and didn't know how to get food. And sometimes that was arranging food for them. Sometimes that was literally finding someone who could sit on the phone with a senior citizen and explain how to set up a Peapod account. In those early days, it was also very hard to get delivery slots. So that was a very frightening time for people as well, especially older people and people who were more medically frail. They were afraid to go out. They couldn't get on any kind of delivery. And it was a very, very difficult time. We also had a lot of seniors who were all of a sudden trapped inside, couldn't go to their nutrition programs where they may have gone every single day for a hot meal. So we started to work with our senior programs to make sure that they could switch, which they did in absolutely, as I look back on it, it's really extraordinary, the work that everybody did so quickly with no advanced planning and no paradigm for this. They figured out how to go from having a senior center where people would come to home delivery of cooked food so that seniors would have some meals. I also did reach out to Feeding Westchester and found out they had a need for some additional help with staffing. We worked with the state and helped get the National Guard there because you were dealing with huge amounts of food and need. And a lot of your regular volunteers were people who were older and didn't feel safe coming out in those early days. We also did work, as Mecca mentioned, in helping direct some support to essential workers. There were a lot of people who wanted to help and they didn't know. Some people stayed home and sewed masks 24/7, and other people, so we had a lot of offers of different assistance and had to set up an infrastructure in order to figure out the appropriate way to channel that interest and energy. So after a few weeks, as we began, and this was our new normal, we were fortunate to receive some federal CARES Act funding. And we had to figure out what were some of the most important programs. And so I set about developing a food security initiative. And the good thing was that I had an opportunity to touch base with Toby from Feeding Westchester, talk to my colleagues who were taking all these calls, talk to our county department, senior programs and services, DSS, and find out what they were hearing. And so I really feel good about the program that we developed because I feel that it was a responsive program based on the needs that we were hearing. I also asked my colleague, another Leadership Westchester graduate, Susan Wiseman, who's on, to create this database. There are over 200 food pantry programs in Westchester County. Some were closing, new ones were opening. We didn't know, is this a volunteer program? Is it staffed? What days? Is it open to the public? Can anybody go? Do you have to register? So Susan helped us create a database that was really important so we would have a sense of what is the universe. Our food security initiative had four main components with a couple of programs. One was, of course, support to Feeding Westchester, who we were so fortunate to have. It's really our anchor for Westchester County, providing food to the food pantries. In addition, in talking to Toby, we understood food pantries are nonprofit organizations, and they needed funding as well. They needed funding to meet this increased demand. They have to have people, they have to turn on the lights, they have to get the bags and everything. It doesn't just happen magically. So we wanted to make sure that we created a program to support our local food pantries, and those grants are going to be going out shortly to 30 programs that did apply for that. In addition, we created a program to provide food deliveries to homebound seniors and vulnerable populations. Many people continue to be afraid to go out, and and this is a very important thing. We did that by working with a nonprofit partner. We found a Westchester company who answered the RFP for the food, and working with our Westchester County taxi and limousine companies who suffered so much under this, they are providing the transportation of the food. In addition, we felt it was very important to have a case management program for people who were under isolation or quarantine for COVID. When you get that call from a contact tracer, when you've tested positive, they're going to tell you, you have to stay home. Everybody in your household has to stay home. That is a very frightening thing. And many people, many of us would not be ready for that news. You take a test and a couple of days later, somebody tells you, everybody, and you say, no, that's fine. I don't need food. My husband's going out. No, your husband can't go out. Everybody has to stay home. So we made sure that we were able to provide wraparound services for people who were under isolation and quarantine. One of the things that I really am most proud of, working with Shari Asher, my colleague who works with the small businesses, is we built on the program that New Rochelle had started to provide funding for restaurant-based initiatives, and created a funding stream for programs in the municipality, by municipality, that would go to a nonprofit that partnered with restaurants and did one of two things: either bought gift cards for local restaurants to give out to families in need, or bought food from them to give out directly. So we're really delighted with that program, because we all know that the restaurant industry is also an employer, a major employer in Westchester County. And we were deeply concerned about the huge number of waiters, busboys, cooks, etc., losing their jobs. And those are not necessarily high-paying jobs. So the loss, an immediate loss of a job is a very difficult thing, and we wanted to do whatever we could to support the restaurant industry. And finally, as I mentioned, it's Susan is in that position, and so when people call and they want to know what is the universe of food programs in Westchester. We have that information. We're constantly updating it. And I think what we're seeing now is that the food distribution programs have really become mini community centers in the communities in which they are providing services. So we have worked closely with them to do some of our census outreach and promotion there. Unfortunately, people are waiting in line. They have the time. Maybe some of you have seen our census tote bags. We are, I think that even if the need is down, Karen, I think that what we're going to continue to see for the foreseeable future is our food pantry, food distribution programs are going to continue to be real centers of community. And also, when we talk to the providers, we hear about other needs that people have. We're also concerned a little bit about what's going to happen this fall. Many kids are not going to be in school. In the spring, the governor mandated that the school districts had to continue to provide food for students, and I know New Rochelle did an excellent job with that. I'm not quite sure what this will mean. The school districts are dealing with so many challenges right now, so we are concerned about the impact on food insecure families of no meals in school. There are kids who may have gotten breakfast and lunch in school and then gotten a snack or something at an after-school program. And all of those meals now have disappeared as schools are remote only. So we continue to check in with all of you, and I hope that you all will reach out to me or to Susan if there's anything that you feel the county can be doing to support it. We really want to try to be as responsive to the needs and concerns of all of the communities. Thank you. Jeanette, I don't know if anyone else, I can't hear you.
You're muted.
Sorry. I apologize. I know. When all of this is done, there are going to be bumper stickers that say, "You're on mute." And I'm going to get them. Emily, thank you for that overview. So just, inspiring to hear about the level of collaboration that is happening in our county. I think that is an example of how special we are as a community, that knowledge sharing, that collaborating, that gut checking, which helps ensure that we're being really smart and efficient about our resources. And you bring up a really important question about school and food insecurity of our young people. And that's actually a question I'd like to get back to before this ends. I'd like to hear kind of a point of view from the entire panel, if that's okay, a little bit closer to the end. I think that's something people are interested in hearing about. So thank you, Emily. Tom, I'm gonna turn the mic over to you. I think, both Emily and Karen and Mecca have all talked about kind of the trickle effect of food insecurity, whether it be from a health perspective or to the restaurant workers. And I think you bring an interesting perspective related to, public benefits and kind of what you might be seeing at Legal Services of the Hudson Valley. So I'll turn the floor over to you, and so that you can give us a 5-minute overview of what you're seeing and experiencing as it relates to food insecurity.
Well, first, I would like to thank you for inviting me aboard, and I'm humbled to be here with fellow leaders of the community that have been providing services for people in Westchester County and the Hudson Valley. So what I do is I'm a staff attorney with Legal Services of the Hudson Valley. We have offices in 7 counties in the Hudson Valley, and we provide free and comprehensive legal representation to clients with a whole array of civil matters that are poor or low income individuals and families and other vulnerable persons who do not have access to legal representation needed to meet their basic needs. Specifically, we deal with cases that are related to housing. Our number one mission is to prevent homelessness. We also provide advocacy for people that are trying to get disability benefits, public benefits, which is my unit, and I'll speak about that in a little while. And we also have general practitioners that provide assistance for elder law, veterans, LGBTQ, HIV positive individuals. Also provide advocacy for those suffering from domestic violence. My unit, which is public benefits, and it's not a traditional practice area that people usually discuss, but what I do is I provide representation for individuals that are facing what is adverse action against their public benefits, whether it's a denial of services or a discontinuance. And sometimes just general advice or specific advice on their circumstances. But some of the subsets of my unit would be public assistance, which provides a cash benefit for needy individuals and families, some rental assistance, and sometimes a heat benefit as well. Another subset, which is going to come into focus, especially when the eviction moratorium is lifted and the utility moratorium is lifted, is emergency assistance, and that's for people applying to get help that have rental arrears to prevent an eviction, get utility arrears paid off so they could prevent a utility shut off, get assistance with moving expenses, and also people seeking shelter placement at the various homeless shelters in Westchester County. Also, other subsets include food stamps or SNAP, child care subsidy, Medicaid, Medicare Savings Program, and my most popular subset these days, which is unemployment. So what I talked to Nicole when I was first asked to speak on this panel is that at least when it comes to the legal system, we're seeing the calm before the storm, and we're starting to see that calm go away or dissipate, and when the moratoriums are lifted more so. But the federal government has definitely, federal and state government has definitely propped a lot of people up with the extension of unemployment, which included a $600 weekly benefit on top of unemployment. And the clients that we've had traditionally, a lot of them actually had more income during the pandemic, which was great. But we're seeing that benefit expire, or we've seen that benefit expire on the 31st of July. And now people are receiving some minimum $183 a week. And we're waiting for the $300 additional payments to come down to the New York State Department of Labor. Luckily, the state government applied and was approved for an additional $300 a week for individuals that are on unemployment. Also, this includes the pandemic unemployment assistance, which it's the phrase for it, includes people that are traditionally not eligible for unemployment, like self-employed people, people that are unemployed and actually can't work, which traditionally you had to be capable of working. Now you have to be capable of working. So it's definitely helped a significant amount of people. Also with food stamps, there's been emergency allotments, and this SNAP has small allotments to begin with, but it's a little more generous if you receive under the maximum between March and August. We're not sure about September yet. People would receive the difference between what they received and the maximum. Also, there's pandemic EBT, which is for families that have children that were eligible for reduced costs or free lunch at schools that obviously aren't receiving them or weren't receiving them and are not going to be receiving them again. And these are automatically given to households with Medicaid, households with that are on public assistance and SNAP, and households that don't receive any benefits are supposed to get a card. It's a PEBT card in the mail in August. So I would say people on the ground need to know about this benefit, so we could tell people that are accessing our services to be on the lookout for this, and if they haven't received it, to give a call to their local Department of Social Services to see how to get it. All for temporary assistance in SNAP, a lot of in-person requirements have been waived. There's an ABOD waiver, which it means that people that are able-bodied without dependents don't have to meet the work requirement as per the ABOD rules until next year. And then there's also the big benefits in the room, the big protections, which is the eviction moratorium. Right now, landlords cannot evict non-pays and holdovers, people that are holding over without a lease, until after October 1st. What this is going to do is, and I talked about this when I was asked to speak on this panel, and also the utility moratorium is, utilities cannot turn off electricity, water, gas, or phone services when people can't be hurt by the pandemic, and that's till March 31st, 2021. But when the eviction moratorium is lifted, and it's going to be lifted eventually, we're going to see a flood of clients that are facing eviction all at the same time. In a normal time, there's evictions going on at a steady pace, and we're going to see 6 months worth of evictions happening at the same time, on top of people that have lost their businesses, that are going to be going bankrupt, that are going to be facing evictions. And we're all going to have limited resources, and we're all going to do our best, and we just need to be as proactive and as helpful and get in front of it as we can. But that's definitely what's going to happen in the future once the moratoriums are lifted. But legal services, I would say, we were slow with intakes between, I would say, April and July, and now we're starting to see an increase. Elder law unit, my unit, has not been slow. We've been pretty busy, and we've changed our focus a lot. We didn't help with applications before on how to access services as we are now. We were more, when a government actor or a bad actor or a landlord is evicting you or taking your benefit away or denying a service, then we would come in and we would assess the case to see if we'd provide representation. Now we're changed our focus a lot in the before stages. How can we be proactive and more holistic and provide assistance with, are these first people eligible? How can we explain it? Unemployment between March and June, and less so now, we have some cases, have a lot of our cases where I'm applying or I can't apply and I'm pending. I was granted benefits, I was approved, but I'm not receiving them. How do I get them? And legal services had to get together, and we had to figure out what the best avenue would be. And I mean, a lot of us attorneys were taking CLE trainings over and over again and learning as much as we could, and a lot of it was on the changes. So we learned what to do, and a lot of it was call your state legislator. They have access to people at Department of Labor. They have email addresses. Reach out to them. And you know what? I mean, my clients would be calling me back if they didn't get access, and all of them have, I would presume, have their benefits now. And we provide them also additional advice on what other benefits were available to them and what to do if they face eviction in the future. But also legal services had a COVID-19 working group where we learned and digested a whole new areas of law and rapidly changing. It was exciting. And I was a member of that group, and we provided training to our organization and also Know Your Rights videos to members of our community on public assistance changes, SNAP changes, consumer law issues, also paid leave related to COVID, unpaid and paid leave related to COVID, and utilities as well. So we're trying to change our focus to help as many as we can, and we're definitely going to be facing a crisis coming soon, unfortunately. But I hope that the governments step in and do what they can to help people. So we'll see. But thank you so much again, and I can't wait to answer any questions anybody has.
Thank you, Tom. Thank you for lifting up. I think that, what I took away from some of your comments is this is a multifaceted issue. It's not just about the health issues or the mental health issues or the physical issues, but there's also a trickle-down effect to kind of everyone's kind of component of life, whether it's, where they're living, their work. And so, thank you for sharing what it is that you guys are doing at Legal Services of the Hudson Valley to provide kind of wraparound services in support of our most vulnerable in the community. And so next, so we're going to shift a little bit, and we're going to hear from two of our nonprofit partners about kind of what they've done in their work to try and meet this need and address this need in our community. So Brigitte, who's the executive director from Groundwork's Hudson Valley, is going to talk about a super kind of creative idea that they have tried to implement in support of fighting insecurity in Yonkers. So Brigitte, I'm going to turn the mic over to you.
Thanks, Jeanette. And thanks to Volunteer New York for inviting me to be on this panel. I'm just so impressed and humbled by all of the work that the esteemed panelists are doing on this issue of food insecurity. Groundwork Hudson Valley is not an organization that's known for working on food insecurity issues. We're an environmental justice organization based in Southwest Yonkers. So Mecca was talking about the food swamps and food deserts. So the 80,000 residents we serve in Southwest Yonkers, about 80% of them are communities of color, and the average household income is less than $30,000 a year. So we're already working with a pretty vulnerable population, and we have historically focused on three primary program areas, which is around sustainability education, so teaching local residents around how to live more sustainably in an urban environment like Yonkers, and ways that people can become empowered to improve the environmental conditions in their neighborhoods is a big focus of our work, as well as youth employment, employing young Yonkers residents around green jobs, and working actually very closely with the county around restoration of the Sawmill River, as well as building things like the Yonkers Greenway, which are really about bringing green space back to areas of Yonkers that have disproportionately been impacted by industrial pollution. So we're not by any means experts in this area. But when COVID hit in Southwest Yonkers, our public education destination, the Science Barge, which is a 1,300 square foot floating barge on the Hudson River, which has a small greenhouse hoisted on top of it. That facility was shut down. We couldn't have school groups come and visit. We usually have 10,000 local school children coming through there. But we teach everything from urban agriculture to climate change. We can no longer use the facility for a public education destination. So while we pivoted really quickly to convert all of our environmental education lessons that we taught on the barge to virtual platforms to help address the sort of growing educational and remote learning needs of our teachers, as well as our parents and caregivers, the question of what to actually do with this floating hunk of steel on the Hudson River became a really serious question for us, and whether we should shut down the facility as a whole and put it on pause until we were past COVID and able to host school groups was something that we really had to come together and think about. Now, as an environmental justice nonprofit, we base all of the work that we do on community needs. And so we actually did a pretty extensive survey process through talking to our local food banks, talking to our local YWCAs, YMCAs, on what the needs were that were bubbling up in the communities. Obviously, what a lot of other low-income municipalities in Westchester, we're seeing increased lines in the food pantries, seeing increased unemployment, even amongst our low-income populations, and really a compounding crisis happening. And so as we reached out to our local YWCA that runs and operates a homeless shelter for women in need in Yonkers, they do provide food, and I think are very strong partners with Feeding Westchester and other food sourcing groups. And what they had mentioned was that they do provide food to their women in homeless shelters, but they were really having a problem at that point sourcing fresh, organic, pesticide-free produce. So they were getting the meats, they were getting the canned vegetables, they were getting the starches, but that locally sourced organic produce was something that was hard for them to access. So we repositioned the barge as and instead of an educational center, we decided to try and grow at scale, deciding how much food we could actually grow. So we have a number of aquaponic and hydroponic systems on our greenhouse, and we augmented those, doubled and tripled those facilities. And we sat down with members from the local YWCA to understand, like, what kind of produce would these women like to see. And many of them were thinking about things like collards and okra and foods once removed from places where they grew up in the South. And so we focused on that, and we were able to, now we were producing food on the science boards for educational purposes. We were growing a lot of different little things for educational purposes, but we weren't trying to do anything at scale. So we stopped growing a lot of different things, decided to amp up our aquaponic and hydroponic systems and grow fewer items at a larger scale. And so now we're producing 30 pounds of produce a week that is going directly to provide fresh organic produce to between 50 to 100 homeless women who go through the YWCA wraparound services. So 30 pounds of produce doesn't sound like much compared to the scale of what Karen was talking about in terms of millions of tons of produce and food sourced across the county. And we're not really suggesting we could ever compete with something like that. More so, I think what we're trying to show and to demonstrate is what might be possible with some of these facilities that were designed for other purposes but had been shut down by COVID. And if we can grow that amount of produce on a piece of steel in the middle of the Hudson River, what might be possible for what residents could do on their windowsills? What might be possible for what residents could do on their fire escapes? And what might be possible for places that are shut down, like the Yonkers Tennis Center? We're in conversations now with them on how can you actually use that to grow food for residents in need? So thinking about a multiplier effect of what some of these facilities that can't function as they normally would under COVID could potentially do to achieve collective impact. That's what we're really hoping to do, is inspire other nonprofits that may not think they could play a role here to realize that there is a role to play, and collectively it can add up to something notable and impactful for the residents in our neighborhoods.
Thank you, Brigitte. And I think, earlier you were kind of asking kind of what your voice or what your niche would be as part of this conversation. And you just lifted it up beautifully. I think that, what we were hoping that you would bring to this conversation is just a really concrete example of the creativity and innovation that we're seeing across the county. And also, what happens when communities come together to identify what the needs are and collaborate with their nonprofit partners and use what they have. And so, bravo for kind of leaning into what you guys do best and for kind of lifting up this conversation to the 100 or so people that we have here today. Hopefully we've planted some seeds about other ways that people can get engaged in their community. So thank you.
And Jeanette, if I could just add one more thing, which is building off of something that Mecca said earlier, which is sort of the physical health benefits of nutrition and food and how that plays out. And we also have a partnership with the Grayston Foundation, which runs a number of community gardens across Yonkers. And again, those are small plots of land that aren't necessarily going to feed a county at scale. But we have done a lot of research. In fact, we partner with Manhattan College, Department of Kinesiology, to look at the immediate health benefits. And what we found in surveying community gardeners in the time of COVID is that this also extends beyond physical health. The mental health components of bringing people together to grow food, especially in a time of COVID where people are feeling like they don't have control or agency over their own lives. the community gardeners that we surveyed in partnership with Grayson, there is a social and mental health component of this that allows people to come together, build social cohesion in a time of isolation, and also help people regain self-efficacy, self-agency. I might not have control over what is happening in the world around me, but I can grow this item for my family. And I just want to reiterate the mental health components of this, in addition to Mecca's good points about physical health.
Thank you, Brigitte. Super important. And now I'm going to turn the mic over to Diane. Diane, you are the Executive Director to People in Rockland. And so we'd love to kind of hear from you what you're experiencing. And then also if you could include your participation in our 9/11 drive and kind of why you've chosen to participate in that initiative.
I'm Diane Serratore. I'm the Executive Director of People to People, and it is Rockland's largest primary hunger relief organization. I started there in 2008. It was a very grassroots organization helping maybe 400, 500 families a month. Then we had the Great Recession, changed the world for a lot of us. Then we had Hurricane Sandy. Now we have COVID-19. It's like every day's an adventure. And the thing that I am awed by all of the folks on this panel is the resiliency and the flexibility and the creativity that you all have brought to what needs to be done. Because every day, you know, I said we're trying to make plans on shifting sand, which is not easy to do. But, you know, we still manage to do it because we know we have a commitment to our community. And I really applaud so much of what all of you have said resonated incredibly with me. So I want to thank you. I had just come back from being on surgery on March 3rd when everything started to happen, Emily. And, you know, it started to trickle in. First, schools were going to be closed for 2 days. Then they were going to be closed for a week. Then they were going to close for 2 weeks. Then they were going to be closed for eternity. So we needed to kind of figure out what the heck to do. People to People serves about 60, 70 families a day. They are low income, no income families that need help putting food on their tables. When COVID hit, March was kind of, everybody was frightened, very frightened. So lots of folks stayed home. They didn't know what to do. They didn't know what to do with their kids. Seniors didn't want to come out of their houses. In April, folks realized they were going to need help feeding their families. And we saw such a staggering increase. We had our regular clients, and they're more like chronic food insecure. There's a number of issues which many of you have touched on: economic, employment, education, housing, transportation. You know, when folks come to a food pantry because they need help in putting food on their tables, that's just one of the many issues that underlie the whole situation. It's like it's their path into trying to figure out how to deal with the other issues, which is why we do the best we can to do referrals and additional information for our clients. But we were really slammed in April and May. We had about 400 new families in April and 480 new families in May. This was especially impacted on us because many of our volunteers are seniors. They are retired. Some of them, they're 90 and dedicated to us. They weren't coming to us. Their families were afraid for their health. They were concerned for their health. So we called Volunteer New York, and Volunteer New York was incredibly helpful to us. We began to generate additional volunteers from houses of worship, Rotary clubs, Boy Scouts, etc. But getting through the beginning crunch time when all of our volunteers were afraid to come in, we would not have been able to continue to do what we do without the help of Volunteer New York. So really incredibly grateful. We had to change the way we do things. We were very excited when 2 years ago, working with the Regional Food Bank of Northeastern New York and the Food Bank of the Hudson Valley, we implemented what we call client choice. Clients would come in and work with a volunteer and literally go through the pantries if they were in a supermarket and pick out the food items that they wanted to serve to their family. That first of all, it's much more dignified. It makes it much more, it's not like somebody's just hurling a bag of food at you. They were very involved in it. They got to pick food that was more culturally comfortable. You know, not everybody likes pasta, not everybody likes beans. But when this happened, we couldn't have them all coming in the building. So we had to rethink, how do we do this? We went to curbside pickup. That's still difficult. You know, as the weather gets colder, how do we have people standing outside, even though we've got tents? We have to rethink everything we do. We have been able to provide the assistance that is necessary. It has brought out, again, a number of partnerships. We work, People to People works with the United Way of Rockland County. People to People is on the Rockland County VOAD, Volunteer Organizations Active in Disaster, and we met regularly to figure out how can we connect the dots between government, private, hospitals, and nonprofit organizations. Because, and I know many of you are aware of that, when everything else was closing, nonprofit organizations had to keep running, had to keep going. Because when there's a crisis, it's the nonprofit organizations and government and private partnerships that make sure the immediate needs of our most vulnerable are met. And that is a big responsibility, but you all do it every day. So we had to kind of rethink. We worked with the VOAD. What's very helpful to us, Emily, you were mentioning trying to get together a database about the food pantries and feeding programs. For us, the United Way has a helpline, 211, and if you call in, it will tell you where there's organizations that can help you in those areas. So that was incredibly helpful to us because we serve a lot of people. I have 5 full-time employees. So without volunteers, we can't do what we do. One of the things that has been incredibly challenging, and particularly in the beginning, and some of you have addressed it, it was our whole, you know, the food supply chain. You know, it's March and everybody needs food, and we've got more people coming to us in April and May, but the food bank couldn't get food because the suppliers didn't have any. So what do? We were able to find some other partners, private partners that provided food to us, which is why, you know, we have been trying to pivot from food drives more to fund drives. But now, because we can't always rely on what used to be totally predictable food distribution systems, we need to, you know, kind of think about what happens in October if it's another March and April. We need to figure out how to make sure we've got the food on our shelves so we can get it on people's tables, which is why the food drive that you guys are doing and enthusiastically supporting for September 11th is important. We're also doing something at Pfizer, the Pfizer Pharmaceuticals parking lot on the 12th. It's a food drive-through. We can't have food drives. Nobody can stand in front of supermarkets, but folks can put food in their car, come, we got bands, music, and then we'll have volunteers take the food out. So we kind of have to think about other ways of generating the resources we need to make sure these folks get the food that they need. When you were speaking about the concerns about back to school, what does that mean for kids? One of the things that we are doing is we're adding additional food to our monthly food packages for the family so that they'll have extra breakfast items and lunch items. The schools, the school system has been called upon to do Herculean work. I mean, and it's not just, you know, they're all trying to focus on education, but then it's like how to clean the buses and how to clean the cafeterias. So we're doing the best we can to try to, you know, take some of the pressure off that so that kids can get the food they need, because we all know hungry kids can't learn. And parents who are worried that their kids aren't getting enough food are so stressed out they can't function. Mm-hmm. And we need less stress, not more right now. So we're working to do that. We have a virtual food drive where people can, you know, go online and purchase items. But the thing that has been, for me, most important is the ability to work together with other organizations. You know, we partner with the Rockland County Pride Center that helps provide services to the LGBTQ community. They don't have a food pantry. They don't want to be a food pantry, but their clients need food. So we provide it and make sure that they're able to distribute it. The same goes with the Center for Safety and Change, whose clients are victims of domestic abuse. their clients need help. They don't want to be a food pantry. I'm not going to be a center for safety and change. So by working together, we can all do what we do best and make sure everybody gets the services that they need. One thing that we saw early on is that our seniors, the seniors that come to us for food, were afraid to come out of their houses. So we partnered with the Rockland County Office for the Aging. We provided food. They gave us a grant. We provided food, and they were able to get folks to go and deliver it. Now we're working with them on a weekly basis to make sure the seniors in our community get the food they need. It is a challenge. You know, we don't know what tomorrow is going to look like, but we're all trying to plan for it. The good news is we do get the support from our county government. County Executive Ed Day has been incredibly supportive. The town supervisors have been there for us. And it's important that we figure out a way to work together. We all are painfully aware that governments are not going to have a lot of money moving into the next year as they start to budget. The sales tax revenue is vital to how they provide services, and they've taken a significant hit there. So how do we pivot and figure out how to do more with less, but make sure that the basic needs of the most vulnerable amongst us are met? And that's our job, and that's what we do. We can't do it without volunteers. We can't do it without our allies in government, and certainly our private business supporters are essential. But at the end of the day, we have a responsibility to make sure that folks that are having difficulty get the support that they need. We are ramping back up. Some volunteers are starting to come back, which is essential to us. We've also worked with the Department of Youth. They provided some folks for us to work during the summer. But it's fall. Kids are going back to school. People are hopefully going back to work in some way. So again, every day we have to revisit how do we do this. But every day, just as you all do, we do it because we have to. That's it.
Thank you, Diane. That's a great way to kind of close this section of our program. I think I just want to echo my thanks and appreciation for all of the knowledge sharing and experience sharing that has happened, in the last hour. I hope that the audience has heard a diverse group of points of view and experiences, and hopefully kind of walking away with some inspiration about what's happening in our community in this kind of COVID-19 landscape. We have about 10 or so minutes for questions. And so I'm actually going to turn it over to the audience, if you will. Folks can write questions in the chat. And our panelists will be here for a little bit longer, and then we can answer any questions and then wrap up. So there was a question before related to, give me 1 second. So validating Brigitte's point about kind of being creative and expanding to include all populations in Westchester because local food resources may be increasingly insecure. Is there anyone out there thinking about this issue? So how do we expand this idea of, is somebody thinking about a flower box program? How are we kind of coordinating and collaborating around really being kind of creative about the spaces that people have access to? Does anybody have any knowledge or experience that they want to share related to that?
Can I just add something? Is that okay?
Sure. Go ahead.
Things that we work with Cornell Cooperative and some others called Plant a Row for the Hungry, and it involves community gardeners. We've got one, we call him the Zucchini King or the Prince of Produce, depending on his mood. But he brings hundreds of pounds that he grows in his own backyard. We work with Naya Community Gardens. A lot of the houses of worship have gardens, but I would love to kind of figure out how to do this wonderful windowsill kind of thing, because not everybody has a garden, but there's got to be a way that, again, if everybody can do a little bit, we can make a big difference. So thank you, Brigitte.
Robert Wingate shared in the chat some information about nutrition needs and resources for school-age children and youth. So thank you, Rob, for sharing that link. A question in the chat box for any or all of the panelists. How much of the populations you serve remain without food? How much do we have to do to reach everyone who needs help? That's a good question. I'll open that up to the panel. So how much of the population that you serve remain without food? How much do we have to do to reach everyone who needs help?
Such a great question. I'm happy to speak to that at least partially. So one of the things that we're doing and have expanded is not just providing food to our pantries and partners throughout the county, but how do we balance that with those folks that Lewis is referencing and that Emily and others spoke about tonight? So our homebound seniors, I've heard stories about children who both parent to the EMTs, and so they can't leave the house. Like, who are our folks who are homebound? We have had an amazing partnership with DoorDash and the United Way of Westchester and Putnam. Anyway, we have this fabulous program with them, and we are hand delivering. DoorDash drivers are hand delivering food to folks who can't get out and access the pantries. And so I think we have to be agile. We have to be innovative, and we count so much on our partners who know their communities so we can identify the gaps in services.
Thank you, Karen.
This is Mecca. I think another, when it comes to this issue of, first of all, just identifying people, we have to really do more to eliminate the stigma associated with this. I think even with the screenings that we do, there is still a reluctance on the part of people to divulge that this is their situation, that something as basic as food, which many of us take for granted, is something they don't have access to or can't access for their loved ones. And I think, especially now with COVID being what it is, you're seeing people who have never needed to go to a food pantry, who have never needed to seek those services, now seeking them out. And so I think we have to, again, removing the stigma is one thing. The other is just being innovative. I was reading recently about Lyft in California, that the company for people who live in underserved populations where there are food deserts, which the data can show exactly where that is, that Lyft charges like a flat rate of $2.50 per mile or something to take those people if they're going to a grocery store outside of their immediate neighborhood. So even, when you think about a car sharing company, a ride sharing company, and the fact that they really don't have anything to do with this particular fight, they made it part of their mission, vision, values to create accessibility, to create opportunities for people. And so they got outside of what they normally would do so they could have some impact in this space. And so I think as we continue to kind of innovate and find partnerships where they didn't necessarily exist before, that's one of the ways we can really make a dent in this and have an impact.
Thank you, Mecca. Diane, one last comment?
Yeah, New York State Assemblyman Ken Zabrowski has arranged for People to People to get a significant grant so we can develop a mobile food pantry and literally drive to the areas where people have difficulty with transportation. We are located in the center of Rockland County in Nanuet, but we serve the entire county. And we see folks coming to us with in taxis, and we know it costs them money. And we try to work, we have bus vouchers and things like that. But if we can get this mobile food pantry up and running, then we can actually work through the community centers like the Havisdorf Center and the Nyack Center and the Martin Luther King Center, and go to where people are instead of expecting them to come to us. That's, not happening today, but it's something that we're getting funding for, and we'll make happen as soon as we can. But you're right, Mecca, we have to kind of think about how to do things differently, because none of us know what the world's going to look like tomorrow or 10 weeks from now.
Thank you. Another question is actually directed towards Mecca. Mecca, would you comment on the intersection relationship between social determinants of health and systematic racism?
Mm-hmm.
I don't know. I think that we like in 30 seconds or less.
That's what I'm going to say. I mean, we could do a whole section on that alone.
Yes,
right.
We could.
Yes.
Here's what I'll say. I think, especially in this current climate, you have more awareness being paid by institutions to the issues of institutional racism, unconscious bias, et cetera, especially for those, and this has been an issue in the nonprofit space. I sit on the board of the United Way of Westchester and Putnam, and for our large nonprofit summit, it's going to be all about diversity, inclusion, equity, access, and eliminating systemic racism. And so I think you're seeing more of the organization saying, what's our role? What are we willing to do? Because particularly nonprofits are in such an altruistic posture. Sometimes it's not easy to hold that mirror up to themselves and say, where's our deficit? Where can we be better? Especially because so many organizations are serving diverse communities. They're serving Black and Brown communities. And how do they make sure they're responding in a way that really benefits those communities? So I think if anything, it's this current time has heightened that effort, but some organizations had already undertaken this as part of what they needed to do. So I think it's a wonderful thing. I think it requires some real conversations. It requires people to be somewhat uncomfortable. But if we're all in this work to make a difference and be advocates for those who need it, then we've got to be willing to sit with that discomfort and sit with some really unpleasant truths. And I think that for the first time, you're seeing so many organizations be willing to do that affirmatively, in your face, robust activity, out loud, even saying and even admitting that systemic racism exists, that unconscious bias exists. I think that, we're moving leaps and bounds ahead of where we were. There's still a lot of good work to be done. And I think you're seeing organizations being willing to put in that effort now.
Thank you, Mecca. That was a meaty question. Thank you so much for so beautifully handling that right there. Another question in the chat box is, 2 sectors weren't represented on this panel, faith-based and business. Can the panelists speak about ways they are working with these sectors?
I can mention a little bit about what we're doing at the county. We have a faith-based liaison, Crystal Collins, and she's been working with our faith-based community. Many of them are doing food pantries, and I forget who was saying, and it was a good point. We have a number of organizations and locations dispensing food and involved in food distribution who've never been in that space before. For example, we've worked closely, and I know, Karen, you guys have, with buildings, and we have some buildings that have their own program. So we are working closely with the faith-based community, especially in the food distribution. And in terms of business, I think we probably are all working with businesses, to many businesses who have the ability to help, wanted to help, and they wanted to know. I tell everybody to give money to Feeding Westchester, just saying. But wanted to know how they could be supportive. Many other businesses are suffering themselves. And so, as I mentioned, at least in our food program and a number of other grants that we have that are for both businesses and for nonprofits, we've tried to work hard to continue the support, especially for small businesses, knowing that their margins are much lower and they employ a lot of our community residents. So we would love to bring our economic development team back, and Crystal, of course, to talk about some of these items.
Thank you, Emily.
I'm happy to add in just a couple thoughts, which is, as some of us have referenced, the history of hunger relief in the nation is through those faith-based organizations, right? Pre-COVID-19, 80% of pantries were run out of churches, and then and other faith communities. So exactly what we're talking about happened, which is they're volunteer run, the volunteers, many of whom are older. And so when COVID happened, health and safety concerns were high priority, as they should be. And so that's when so many folks, including the county, including organizations that were serving the community, but not through food, and food banks. We said, what can we do to make sure that we're getting food where it needs to be throughout the county? And so that's where a lot of the innovation took place. And then, yes, we are so grateful for all supporters at every level, including businesses. We've seen them step forward in really exceptional ways to ensure that our neighbors have food.
we work with a lot of the faith-based organizations. We do provide them with food. They come to a mass distribution. But many of the houses of worship in Rockland are incredibly generous financial supporters of people to people. They don't have a pantry of their own. They're going to support us. We're going to make sure that the folks in their area get food. We are supported by small business. Most of Rockland County's businesses are small businesses. We do have some giant ones like Orange and Rockland and Pfizer, and they are incredibly supportive. Pfizer did a virtual food drive for us because they used to do a big food drive collection. Nobody's going to the building except for the scientists, thank heavens. But so they did a virtual food drive and raised money so we could buy it. So we're trying to think of new ways. But again, nonprofits can't exist without partnering with every facet of our community. We can't do it by ourselves.
Thank you, Diane. We have time for one more question, but I do want to share that I'm going to ask my colleagues at Volunteer New York to grab the outstanding questions, and we will make a commitment to you all to review them. I see that there are some folks who are representing nonprofit organizations who have participants that might need some information, and so we will make a commitment to circling back to those folks so that we get you that information, and then also see if we can answer any outstanding questions as well. So we will grab those and circle back to you as soon as possible. And then our last question is, Jim wanted to know if the panel is aware of any kind of overarching organization, either in Westchester and Rockland, where all of the numerous organizations report info to, so that there is a snapshot of all food insecurity initiatives, and as a result, identify where shortfalls may exist.
I kind of think that's Karen.
Yeah, I was going to say hi. So Feeding Westchester is delighted to serve that role. I so appreciated Emily's shout out to Toby. Toby's been with Feeding Westchester for 15 years, I think, and excuse me if I'm misspeaking, but that is what we do. So not only do we report out, and I wanted to make sure that we say tonight, it's not just if you want to help. If you or someone need help, certainly feedingwestchester.org is a resource for both of those worthy endeavors, right? And in addition, there's a space on our website where you say where you live and you see the resources that are in that area. Certainly we are aware and concerned about any remaining gaps. I've been in hunger relief a long time, and I find it difficult to imagine that we are helping everyone that needs help. That just doesn't seem possible. And so if there are specific niche needs, again, we have a wonderful 211 partnership with our United Way that answers calls 24/7. And so help is always available, not just for food. I was so appreciative of my colleague who talked about mental health. The pressure of what is going on in the world today is so hard on our families and our residents.
Thank you, Karen. I don't think I could have scripted a better way to bring our conversation to a close. So on behalf of Volunteer New York, I want to thank again our panel for joining us this evening. Thank you to the over 100 folks who've joined us throughout the last hour and a half to hear more about the food insecurity landscape in our communities, the incredible innovation and creativity and collaboration that's happening to help support our neighbors, and examples of what they can do to contribute as well. Just as a reminder, everyone that registered for the event will be receiving a thank you email after this program with information about each of your organizations, as well as with volunteer opportunities connected to our Volunteer New York database, including our 9/11 food drive that will be supporting people to people, including and also nonprofits, food pantries in Westchester and Putnam. The list is there on your screen. And we will be sharing this webinar on our website next week. And so We hope that you will also spread the word, and so those that might not have been able to participate can join us and hear about what was discussed as well. And so at 8:29, because we are very mindful of time at Volunteer New York, we will close. That is my contact information, and thank you again so much, everyone, for joining us. We really appreciate you.
Thank you.
Thank you.
Thank you.
You.
Thank you. Take care.
Applause for all of you.